Hello, Wayne County Community College students. I'm Dr. Morrison. We're now entering to the next lecture on cardiovascular. This is on the heart, actually. We're using a Human Anatomy and Physiology textbook, as you know, by Patton. We're on chapter 28. Yep, 28. Okay, so let's get started. Here we are, we're talking about the heart. The location of the heart is in the mediastinum. The mediastinum is in the middle of the thoracic cavity. So it's in the middle of the chest, right? The middle region of the thoracic cavity, just behind the sternum. The size of the heart is usually, the average size of a heart is the size of your fist. So my heart would be about this size, right? A bigger person with bigger hands or so would have a bigger person would typically have larger hands and the heart would be larger. Little baby, little infant, they ball up their little hand, that's the size of their heart, so you get it. The heart pumps approximately 5 liters of blood. Now I think in some texts it says 5.5 liters. Okay, anyway, we'll say approximately 5 liters. The heart weighs, in the male, the heart weighs about, on average, 310 grams. And in the female, it weighs about 225 grams, okay? Now, I want you to know in embryology, when they were first looking at the heart, it looked like this, okay? Not exactly like that, but it looked like the way the heart was like this. So the embryologists named the bottom of the heart, of course, they named it the base. But that's when we were embryos. The heart, as we got older and matured and developed, by the time we became an infant, let's say by the time we became from an embryo to a fetus, by the time we became a fetus, the heart had turned 180 degrees, and now it would look like this. So this top part, so the bottom was called the apex, and the top is still referred to as the base, because they did not want to, I don't know, maybe they didn't want to be wrong, or they were like, well, that's what the name of it is, no matter where it is. We're just going to keep the point being the apex and the bottom part of it where these lumps are as the base. But this is the way it is now, and so it's named the opposite. Apex is usually at the top, you know that, and the base is usually at the bottom. But in the heart, they named it too quickly in the embryo stage, didn't know that it was going to do a configuration of twist of 180 degrees and end up like this. But they kept the names as though it didn't flip. All right, so the heart, just so you'll know, it has a pericardial sac. So let's just draw a heart here. And I just want you to know the heart doesn't really look like that. We're just drawing it like a Valentine, just because we can. All right, so around the heart is encased in let me just write this. Oops. A pericardial sac. Peri means around, cardio means the heart. The sac, of course, is the encasement that's around the heart. That's going to be important because it has in between the pericardial sac, this case that encloses or surrounds the heart, there's fluid within that, in this general area. Pericardial fluid. Around the heart, there is fluid, pericardial fluid, right? All right, let's talk about the pericardial sac with this fibrous pericardium. The outside of it is tough and it's a loose fitting, but it's inelastic. So it's tough but it's firm, right? It doesn't stretch. And that's around the heart. And usually you'll see that a lot of organs are covered with something tough on the outside of it. Something pretty, maybe not fibrous, but it is a tough covering. Just like the brain is covered with a tough mater called dura mater. It actually means tough mother. Dura mater means tough mother, but that covers the brain. This, the pericardial sac, is the outside of it is covered with a fibrous pericardium. Now, the other side of it is a serous pericardium. The serous pericardium itself consists of two layers. You have the parietal layer, that's the lining inside the fibrous pericardium. So the fibrous pericardium has a lining in it, right here on the inside of it. And then you have the visceral layer. A visceral layer is also known as the epicardium. Epi meaning above the heart. So just above the heart, the visceral layer, which is intimate with the heart, and just say it's the heart itself, the tissue itself, it adheres to the outside of the heart. Between the visceral and the parietal layers is a pericardial space that contains a few drops of pericardial fluid. So, this is the pericardial sac on the outside, but just on the other side of that, in here, is the serous layer of pericardium. And then right on top of the heart itself, where this black is the visceral layer, or the epicardium. Right? Let me try to explain that in a different way. So, say you have a wool skirt or wool slacks on. You know, wool as a fabric is itchy, but wool is an excellent fabric to wear in the winter, fall, if you're trying to protect your legs or your body from the cold. But it is an irritating fabric for most people. So what do you do with that? Well, just say it's a pair of slacks and you want to line that pair of slacks. Let's do the skirt. You want to line it. And so what do you do when you want to line it and you don't want that itchy part touching you? Well, of course, the itchy part of it is the fibrous pericardium. This is the tough layer. This is the wool, so to speak, which is in red here. That's the wool. Yeah, it's tough. It'll keep you warm, but it's irritating. You don't want to irritate the heart, just like we don't want that wool irritating our legs. So we're going to put a lining in there, right? All right. Say it's a slip. So you put on a slip. I don't know if people even wear slips anymore, but it's a slip or a lining. That's all a slip is. Part of the slip or the lining will touch the inside of the wool, correct? So you have the top part will touch the inside of the fibrous pericardium. But then the other side of the slip will touch the person's legs. The other side will actually touch on the heart, the smooth side. So there's a lining between the fibrous pericardium and the heart itself. And that will be the parietal layer and the visceral layer. The parietal layer is the lining inside the fibrous pericardium, the lining right inside here that is touching the wool. And then on the other side of that, let me see if I can explain this. So this coat is the wool itchy part. I'm going to put a lining in there, right? Okay, this piece of paper, if you can see that. This piece of paper is, one side of it is touching the wool itself, and the other side is touching my leg. So one side of it is touching the wool part here, and that will be the parietal layer lining inside the fibrous pericardium. And then the visceral layer, which is touching the heart or is intimate with the heart itself, known as the epicardium, that adheres to the outside of the heart. So that's all this is talking about. The fibrous pericardium, and then the serous pericardium has two parts to it, which you will know as the lining of, or the slip to the fibrous pericardium. All right? Let's go over the structure of the heart. There's three distinct layers of tissue. The epicardium, we talked about epicardium already here, where we know the epicardium is actually the visceral layer. Visceral means the organ itself. The epicardium is the outer layer, also known as the visceral layer of the pericardium. Epi means above the cardium, so on the very outer layer, outside of it. Myocardium, myo means muscle, so this is the muscle layer of the heart. And we talked about myocardium before when we looked at, for example, when we looked at myocardial infarctions, right? When a person has a heart attack, that muscle is damaged. So here's myocardium, myo is muscle layer. This is an involuntary striated muscle layer, a striated muscle, much like skeletal muscle, but not exactly, because cardiac muscle is a little different because it has intercalated discs and gap junctions. This difference makes all the difference, because these intercalated discs are important because it provides communication between the cells. In other words, the intercalated discs allow the heart muscle to contract as one unit. That communication with the muscle fibers allows for the heart to contract as one. Endo meaning inside or the inner layer of the heart. Endocardium, inner layer of the heart, is a smooth trabeculae type of inner layer, and it regulates the flow of blood. So you have the endocardium, a smooth trabeculae. So it's kind of, when we say trabeculae, we can say it's kind of lacy looking. And you can see this in your text. And it allows for a smooth flow of blood in the heart muscle. One thing I did want to say about the myocardium, this involuntary striated muscle, yes, it's involuntary. In other words, you do not have to think about your heart beating. It's going to be, has an auto rhythmic to it. It's got a self rhythm, right? You don't have to think about it. This auto rhythmic beat has the heart contract on its own. It contracts on its own without you thinking about your heart beating, okay? So that's a good thing. You don't have to concern yourself with your heart beating. All right, so we went over this. We know where the heart is, how much it weighs, how much it pumps. We realize that the heart has its own sac called the pericardial sac. It sits in its own sac. We know there's two parts to it, a fibrous layer, a serous layer that we consider the lining. One part of it's going to touch this little wool part, and the other side of it will touch the actual heart itself. And then these three distinct layers of tissue, the epicardium, the myocardium, and the endocardium, are the tissues of the heart that we need to know. The next thing then will be for us to talk about auricle. Auricle means little ear. So I'm just going to write these words up on the board here. And I think you got this pretty much. We don't need to really take a picture of it because I've gone over it a few times. What I'm going to do now is just try to keep it moving. And we'll give some definitions to some words that you're going to come across in your reading, right? So let's look at auricle. Auricle means little ear. So it looks like an auricle, little ear, right? This is a ear-like flap protruding from each atrium. Now, I want you to know that an auricle is not an atrium. And we're going to talk about that, what is an atrium and all that in a minute. But for now, I wanted you to realize the auricle is the outside of the heart. The atrium is the chamber inside the heart, okay? This is just the little ear, and it does look like a little ear flap that protrudes from each atrium. Another word to be familiar with would be chordae tendineae. Chordae tendineae. Chordae tendineae is cord-like. These are structures that anchor the papillary valves, the papillary muscles, okay? So these chordae tendineae, to me, it reminds me of a parachute, like the way it looks, that all these cords come down. And when you see it, you can make it, remind you of whatever you want, but it reminds me of a parachute. And these are structures that anchor in the papillary muscles, and they are help anchor with the valves, the aortic and the pulmonary valves, for example. We just say that for example. In other words that I want you to know are semilunar valves. The semilunar valves are the aortic and pulmonary. A-R-Y valves. Okay? So half moon valves, right? So these kind of look like that, like a half moon. These are the aortic and pulmonary valves. Atrioventricular valves. Where do you think these are? Between the atrium and the ventricle. We're going to talk about this in a minute, but just to give you an idea, this would be the mitral valve. This is also called the bicuspid. Some people call it mitral, some people call it bicuspid. And the tricuspid valves. So I'm mentioning this because, people could call these all different things. And if they say, oh yeah, we're talking about the semilunar valves, I need you to know that they're talking about the aortic or pulmonary valves. Oh yeah, we're talking about the atrioventricular valves. Well, the only valves that are between the atrium and the ventricle would be the mitral valve or the tricuspid valve. The mitral valve on the left of the side of the heart and the tricuspid valve on the right side of the heart. So that's just so in case somebody uses these different terminologies, you will be familiar with them. Another thing is, let us just now, since we're going to learn about the heart, let us go on and learn about the blood flow of the heart, okay? So let's do that. All right, so let's talk about the heart. We're going to talk about the flow of blood through the heart. And I need you to get this because you are going to have to memorize this. It's not a big deal. It makes perfectly good sense on how the blood flows through the heart, all right? So the thing is, for the heart, I'm going to need you to remember the number 4. 4 is going to be the magic number for the heart, okay? 4. Remember that. So let's draw the heart. When I draw the heart, we're going to use a box configuration. So let me just start first here. And here. And we'll take a picture of this to make sure that you have it. All right? So we'll just leave it at this. Now, blood is going to come from here and from here. This vessel here is one of the largest, these are the largest veins in your body. This one at the top is superior, so it's going to drain everything from the head, neck, shoulder region into the heart. So this is known as the superior vena cava. Very large vein, okay? This one, the lower one, is going to drain everything from your feet, legs, thighs, abdomen, thorax area into the right atrium. And this, since it's lower, is called the inferior vena cava. These are veins. Vena cava are veins, okay? So let me just make this point by showing the blood draining the upper aspect of the body, going into this large vein, and then draining the lower part of the body in this other large vein, the inferior vena cava. Now, when the blood drains from the superior vena cava and the inferior vena cava, both of these veins empty into a chamber. So remember, first of all, you must know your anatomical positions. Please note that we're on the right side of the heart here, and over here, we're on the left side, okay? So if I'm facing you, you know that this is the right side of my heart over here, and this is the left side of my heart over here, okay? So just remember your anatomical positions, okay? And always, always, before you start doing anything on an exam, especially if you're looking at a cadaver or whatever, or a model, for example, always orient yourself first. So you'll know what is on the left and what is on the right, or what's superior, what's inferior, okay? What's anterior, what's posterior. Always orient yourself. So everything is coming into this area here. Now, I'm just going to show you how this goes. So, how many chambers do you see? 1, 2, 3, 4. Told you 4 is going to be the magic number to remember for the heart. This is the right side of the heart, so this blood is draining from the superior vena cava and the inferior vena cava into this chamber, known as the right atrium. So blood from the inferior and superior vena cava both drain into the right atrium, okay? Now, we can't have blood just hanging out in the right atrium, so you have to have a valve between the right atrium and the blood. Well, I'm going to put an asterisk here because it's too big a word for me to write, and that word will be right here. This is going to be the tricuspid valve, right? And the blood will now come from the right atrium through this tricuspid valve into this chamber here. This is still on the right side. This is the right ventricle. All right? So far, so good. So we have blood draining from the superior aspect of the head, neck, shoulders, upper aspect of the body, and blood draining from the lower aspect of the body, the legs, the feet, the legs, the thighs, and the abdomen, into the right atrium. The blood will leave the right atrium, go through a valve, Valves are extremely important, so always remember your valves. Going into the right ventricle. So now that's the right side of the heart taken care of. Blood cannot just stay in this right ventricle, so it's going to leave the right ventricle. So let me draw another vessel here. Right here, leaving the right ventricle. And I'm going to show you here, there's a valve here. Let me try to kind of open that up a little bit. Here it is here. I'm going to put 2 asterisks there because the word is too big for me to write for that valve. It's a valve right here, here, and here. 2 asterisks here will indicate a pulmonary semilunar. Remember that half moon that we talked about? Semilunar valve. Blood will leave this area from the right ventricle, go through this pulmonary semilunar valve. See how it's going through there? All the way over here. Now, the word tells you pulmonary, right? So where do you think the blood is going? Blood is leaving the right side of the heart through the pulmonary semilunar valve into this vessel known as the pulmonary artery. Artery. All right, spell that. That's a pulmonary valve here, and then this vessel is the pulmonary artery. So blood has to go through the valve before it gets to the artery. Now the word pulmonary tells you where it's going. And I'm just going to draw a lung right here. So this is a lung. But I want you to know that this pulmonary artery is going to actually have blood going to both of the lungs. But now, for our sake, we usually just talk about the left side of the heart. From this point, we'll just talk about the left side. But I need you to know that the pulmonary artery is shaped like a T. It's T-shaped in the back, kind of like, well, I'll show you. Pulmonary arteries and things are T-shaped like that to go to the left and right lung. So go this way and blood can go that way. But for our purposes, we just talk about the left side. All right, so we got blood leaving the right ventricle, going through the pulmonary semilunar valve, through the artery, pulmonary artery, into the lungs. Why? Because the blood needs to pick up oxygen. That's the entire reason you breathe, is to put oxygen on a red blood cell. Okay, so now y'all, these red blood cells in the lung, you know red blood cells, you know that's important. All right, so you breathe in. Good. Get some nice oxygen. And now the red blood cells pick up the oxygen because you learned about heme and you learned about oxygen and you learned about the hemoglobin. So you know that oxygen, a lot of oxygen is on the red blood cell because that's what the red blood cell's job is. One of them. Anyway. Now, this blood needs to be oxygenated, so it's going into the lung to get the oxygen. And what is going to happen? The blood is going to come out. This oxygenated blood is going to come out of the lung through this pulmonary vein, the pulmonary vein, back into the heart. If this is the right atrium, what chamber do you think this one is? Correct. You know that we're on the left side of the heart. This is the left atrium. So pulmonary blood, fresh oxygen, comes through and ends up in the left atrium. Okay. Now behind this pulmonary artery, I know this heart is getting a little jumbled up, but I need you to know that there is another valve. And we must put about 3 asterisks here so that you will know that these three asterisks represent the mitral valve. The mitral valve, as you recall, had another name, and it's called bicuspid. We just talked about that. Blood is going to leave. This is nice oxygenated blood now coming straight from the lung into the left atrium, coming through the mitral valve, or we call the bicuspid valve, into this ventricle. Or I should say into this chamber, right? Okay? Now this is the right ventricle. What chamber might that be? Correct. That's the left ventricle. All right. So that's the left ventricle. Now, I want you to know something about the left ventricle. I'm going to exaggerate this a bit if I can. I'm going to make it thick. This is a thick-walled chamber, right? It's thick-walled chamber. Why? Why is the left ventricle so thick-walled? The left ventricle is a thick wall because it has a big job to do. Its responsibility is to push all this oxygenated blood to all the tissues of the body. Huge responsibility. This has the largest artery in the body coming out of it. And let me put a valve here, just so you'll know. And I'm going to put it up here like this, so that you can see this. All right. I'm going to put, I'm going to put 4 asterisks here so that you will know that this is another valve. Okay? This is the aortic. We got semilunar. Valve. This left ventricle is thick-walled. Its job is to push all the blood through this valve here, the aortic semilunar valve, all the way up through this huge, huge artery known as the aorta. Largest artery in our body, the aorta. And now this blood goes to all the tissues of the body. That's where that blood goes. All this nice oxygenated blood goes to all the tissues of the body. All right? Now, what I want you to look at here are the 4 chambers. Remember, 4 is the magic number. Right atrium, right ventricle, left atrium, left ventricle. Remember them in that order. The atria are at the top, the ventricles are at the bottom, right? You know the right side of the body is bringing all the deoxygenated blood into the heart to carry it to the lungs. The left side of the body, on the other hand, is taking all the oxygenated blood and carrying it through the aorta to all the tissues of the body. 4 chambers. 1, 2, 3, 4. Chambers means rooms, chambre in French. Right atrium, right ventricle, left atrium, left ventricle. 4. 4 valves. Valve here between the right atrium and right ventricle is the tricuspid valve. Valve here is at the beginning of the pulmonary artery, pulmonary semilunar valve. Valve here between the left atrium and the left ventricle is the bicuspid or mitral valve. Valve here coming out of the left ventricle is the aortic semilunar valve. Do you see that 2 arteries are coming out of the ventricles? Yes. What's coming out of the right ventricle? What artery is coming out of the right ventricle? Correct, the pulmonary artery. What artery is coming out of the left ventricle? Remember, the left ventricle has a huge job to do. It's got to push all the blood out of its chamber into what artery is in the left ventricle? Correct, the aorta, the largest artery in the body. Did you count 4 valves? Tricuspid valve, the pulmonary semilunar valve, the mitral valve, also known as the bicuspid valve, and the aortic semilunar valve? 4 valves. Please remember this. The tricuspid valve can also be called, it's on the right side, can also be called the right atrioventricular valve. Please remember that. Okay, that's cool. So what do you think that the mitral valve, also known as the bicuspid valve, can be called? If this tricuspid valve is on the right side between this atrium and this ventricle, this right atrium and this right ventricle, atrium, ventricle, atrioventricular valve. This mitral valve, also known as the bicuspid valve, is on the left side, so it can be called the left atrioventricular valve. All right? So we see that the tricuspid valve on the right side has 2 names. Tricuspid valve, also known as the right atrioventricular valve. On the left side of the heart, the mitral valve has 3 names. Mitral valve, bicuspid valve, or the left atrioventricular valve. I'm mentioning that because I don't know what other authors you may see or read, and they may refer to these valves as different names. Right now, you've learned all the names that they could possibly say because that's all we know for now. I do want you to know that there are 4 chambers and there are 4 valves, right? Let's run through this and then we're going to put it in an algorithm so that you can see how the blood flows, and I need you to memorize it step by step. Blood is going to drain from the superior vena cava and the inferior vena cava into the right atrium. From the right atrium, blood is going to go through the tricuspid valve into the right ventricle. Right ventricle is going to push blood through the pulmonary semilunar valve into the pulmonary artery to the lungs. Blood is going to pick up oxygen, come through the pulmonary veins into the left atrium, go down through the tricuspid valve into the left ventricle, and from the left ventricle, blood is going to shoot up through the aortic semilunar valve into the aorta to all the tissues of the body. So it goes like this, and that is how blood flows through the heart. Let's put it in algorithm form so that you will remember it. I need you to remember the valves, each one, or it's only 4, so you have to make sure that you remember. And write this down in your notes so you will know what you need to know. Let's put this algorithm up. Well, I'm not going to keep trying to put that. Let's just start randomly, because you can start anywhere because it's circulation, right? You can start anywhere. You can start superior vena cava, inferior vena cava. And just for our purposes, that is where I'll start. And then you make the blood flow. But it's a circuit. You can start anywhere because all it does is go around and around and around, okay? But for our purposes, let's start with the superior vena cava and the inferior vena cava. And I'm going to try to put this all in one line. So superior vena cava and inferior. So let's start with the superior vena cava and inferior vena cava, and let's make this blood flow. So you tell me what's next. Good. Right atrium. Remember your valves. tricuspid valve, also known as the right atrioventricular valve, to the right, what? That's right, correct, right ventricle. Where does the blood go after it leaves the right ventricle? No, make sure you remember your valves. It goes to the pulmonary semilunar valve. Good. Pulmonary semilunar valve. From the pulmonary semilunar valve, the blood goes to the pulmonary artery. From the pulmonary artery, the blood goes to the lungs. Why? Because it needs to pick up oxygen. Pulmonary tells you it's going to the lungs, because that's another word for lungs, pulmonary. From the lungs, it's going to go through the pulmonary veins to, I'm just going to erase this because it's getting in the way. Pulmonary veins, it goes back to the heart, to the left atrium. On the left atrium, it's going to go through a mitral valve, also known as a bicuspid, also known as a what? Left AV valve or atrioventricular valve. All right? Oops. Make sure you write this down. Ventricular valve. Now it's going into a large, a very muscular, not large, but a muscular chamber known as the left ventricle. Then what? No, remember your valves. This is the aortic, semilunar valve. Then it's going to go to the aorta. Then where? To all tissues of the body. Good. So, superior and inferior vena cava to the right atrium, from the right atrium to the tricuspid valve or the right atrioventricular valve, to the right ventricle, then the blood goes to the pulmonary semilunar valve, and to the pulmonary artery, to the lungs. Back out to the pulmonary veins to get to the heart again, to the left atrium, to the mitral, bicuspid, or left atrioventricular valve, to the left ventricle, to the aortic semilunar valve, to the aorta. Voila! Now all tissues of the body can get oxygenated and perform any function that they're supposed to perform. I need you to understand a couple of things about arteries. Arteries take blood away from the heart. I don't want to hear anything about arteries are, blue and veins are red or whatever you remember. This is all I want you to remember about arteries and veins. This is it. Is that arteries, and you'll remember that because it starts with the A. Arteries take blood away. So away from the heart. Veins should I say take blood towards the heart? Takes blood towards the heart. This is all I want you to remember about arteries and veins for now. And I'm going to prove that. So, we know that arteries takes blood away from the heart. You remember arteries and away here. Where is an artery on here? Pulmonary artery. Pulmonary artery is taking blood this way, away from the heart, because it's taking the blood towards the lungs, correct? Where's the other artery in this scenario? The largest artery in the body, the aorta. It's taking blood away from the heart, isn't it? To all the tissues of the body. So, arteries take blood away from the heart. Remember that. Let's look at the veins. Well, what veins do we have here? Oh, we have a large superior vena cava and another large one called the inferior vena cava. It's taking blood towards the heart. Inferior vena cava takes blood towards the heart. Superior vena cava takes blood towards the heart. Oh, pulmonary vein taking blood towards the heart. Voila. Can you just remember that? Arteries takes blood away from the heart. Veins takes blood towards the heart. All right, I think as far as this is concerned, I think we'll have a snapshot of it so you can, take your time and especially go through this algorithm. I need this memorized and ASAP, because the way we're going to be talking about the heart, you need to have a picture in your brain and start drawing this square, because I'm going to be drawing this a lot, but you need to understand it, because I'm going to talk more about circulation and other things with the heart. But for right now, learn this and all the names of the valves, and remember the valves. 4 valves, 4 chambers. Remember that the 2 arteries are in the ventricles and the veins are in the atria, right? You see these veins here? Dumping into this right atrium. You see this vein here, this pulmonary vein, dumping into this left atrium. You see this artery here, pulmonary artery, coming out of this right ventricle. You see this artery here, the aorta, coming out of the left ventricle. Simple. This makes perfect sense the way your heart functions. So don't make it difficult. But you do need to memorize it because it's on every freaking test. For the rest of your life, it's going to be on some kind of test. So that's that. I think we'll conclude this video right now, and then when we pick it up, I'll start talking more about the vessels, and we'll learn about these blood vessels, arteries, veins, etc. But I did want to get this big chunk of the circulation of the heart, how blood circulates in the heart right away. So we'll come back and talk about vessels.